my interview with Dr. Michelle Forcier, who is, as you'll hear her proudly identify herself, a gender-affirming pediatrician.
And I'm very happy that we have a gender-affirming pediatrician on to talk about these issues with Matt. Let's hope that he gives her some credence.
My name is Michelle Forcier, and I have a medical degree from University of Connecticut, residency, University of Utah Pediatrics.
So that's a pretty impressive degree. We ought to be listening to this lady.
There's research and data that show that babies and infants understand differences in gender. Some children figure out their gender really early, and their figuring out their gender identity is not necessarily congruent with their sex assigned at birth.
You see, if we listen to people who've listened to children and families, you hear this time and time again. Children understand their gender identity very, very early on. And maybe their first memories will come in at around about 5 that they can remember when they're about 5. But actually, their relatives, their families, their friends, their aunties and uncles and grandparents will say, well, I saw it even before that time, dear.
Telling that family, based on that little penis, that your child is absolutely 100% male identified, no matter what else occurs in their life, that's not correct.
You see, we wouldn't do this in any other walk of life. We wouldn't tell a child, no, you have to do this. No, you have to be this. No, that's not who you are. No, you can't think like that. No, you can't be like that. That's not how the world works. And for the very thought that we use that tiny penis to say, you're a male, and whatever you say, whatever you think, whatever you tell me, I'm not going to believe you. You are a male. I agree. It's just not right.
So medical affirmation begins when the patient says they're ready for it.
I hear this all the time. What age should we start? What age is the right time to do it? What age is too young? What age is too old? I'll tell you, it's when the person themselves are ready for it, when they're ready to make those decisions. And that can be very young. We need to be listening and working with patients. That's how medicine works.
So that could be a kiddo who is just starting puberty.
Interesting point, because you don't need medical intervention before puberty starts.
And panicking because they're getting breast buds or their penis is getting bigger and busier and they're worried about all kinds of masculine changes.
I love that. Bigger and busier. But I tell you who doesn't love that. Trans young girls. No, they don't like that. And trans boys do not like those breast buds. They feel so wrong.
It's about the context of caring for a child and seeing the suffering that kids can have that have not been in affirmative home situations.
We're not just talking about a child here that's not happy. We're talking about suffering. Suffering, that's really extreme. Children who are not affirmed, i.e. believed at home, suffer. And that's something that we really, really got to work on.